The number of people infected with Legionnaire's disease in New York City is rising. But today, the mayor, Bill De Blasio, said the city's working to contain the outbreak and is optimistic it will get under control.
We have 86 cases reported, and sadly, 7 deaths. Our hearts go out to everyone who's afflicted and their families, and particularly the families of those that we've lost. So again, 5 buildings have tested positive for Legionella, and decontamination has been completed at all 5 sites. Those are the only 5 sites that we have evidence of contamination for. The number of cases has been slowly reducing. As I said, since yesterday, 5 more cases, but it suggests a reduction in the rate of increase, and that is good news.
For more on Legionnaire's disease, we're joined by CBS News medical contributor Dr. Holly Phillips. It sounds so frightening when you hear as many as 7 people have died. Right. What is it?
Right, so these numbers are alarming. They're not entirely unexpected once we started to see this cluster of Legionnaire's disease. Basically, Legionnaire's disease is a very severe form of pneumonia. It's caused by a bacteria called Legionella. Now, what's important to know about it is that unlike other illnesses that cause pneumonia, this one isn't contagious from person to person. So if someone has Legionnaire's disease, they cannot pass it on to you. The way it's transmitted is through aerosolized droplets in the air. So it comes from large water systems. Think things like hot tubs, showers, water cooling units that are used for air conditioners for buildings, and large plumbing systems. That's really where the bacteria lives and spreads.
The fact that they found this in the South Bronx, they found it in multiple water cooling towers, does that indicate that there's a problem with water cooling towers? I mean, are they now thinking, oh, we should go inspect water cooling towers citywide? Right.
And in fact, they have done that. I know they have looked at least New York City health officials have said they've zoned in on more than 20, and they have actually sterilized around 5. Now, it's not uncommon to find the bacteria in these water cooling systems. Really, those are areas where water changes from cold to hot. It's a perfect area for bacteria to spread. You just have to catch it early before other people can get it.
We're hearing about it because there's this big cluster in New York City, but does it happen in other places?
It absolutely does. It's a very common illness, and it's seasonal. We see it more in summer and fall, and that's because the bacteria live in water and they prefer warm water. Between 8,000 and 18,000 people are hospitalized with it every year. Not everybody that gets it will die from it. It can be treated by antibiotics, and in fact, it's very treatable when it's caught early. So it's about getting into the doctor at the first sign of symptoms.
Listen, I don't want to alarm anybody, but when you said aerosolized water droplets, the thing that I think about is people putting sprinklers on for the kids at summer, the water parks with the fountains going, and kids running through the water with droplets everywhere.
Sure.
Are kids more at risk?
Well, you know, there are groups of people who are more at risk, not necessarily children. You bring up the fountains in parks. Historically, you know, in other outbreaks, those have been sources of Legionella. The people, though, most at risk of getting the illness are people who are smokers, who have underlying lung diseases like emphysema or COPD or asthma, or who have immune system problems themselves. Most people who are exposed to the bacteria will not, though, get Legionnaire's disease.
If it's a kind of pneumonia, would you expect to see the same types of symptoms, respiratory type symptoms?
Right. Well, one of the challenges is that it does just look like the common cold or the flu right at the beginning. You might get fever, body aches, a little bit of a cough, but then that cough moves into a severe cough with shortness of breath. The biggest thing is to know if there is an outbreak in your area so you can act fast. If you think you may have been exposed and you've developed any symptoms, of course, get right to your doctor. You can be tested.
And how do they treat it?
It's treated with antibiotics. The antibiotics are very effective if it's caught early. As people get more sick later on, that's when we start to see fatalities.
Do you think that the New York City Health Department has a good handle on this now and that we'll start to see those numbers lessen?
Sure. Well, you know, hearing at press conferences, you know, with De Blasio and the other New York City health officials, it does seem like they're leaving no stone unturned. They really are zoning in on these water tower systems in the South Bronx and and trying to sterilize all that are necessary. But it's really about casting a wide net, testing any area that could be infected, and handling it right away. The illness does have an incubation period of 2 to 10 days, so even if they've gotten rid of the source, it's possible we may see some more cases in the coming days.
All right, Dr. Holly, thank you for your time.
Great to be here.